Welcome to the BanishCancer podcast. I'm Rachel, joined by James, the cancer wellness educator. Today we're talking about a rare but serious condition, acute eosinophilic leukemia. It's a fast-moving blood cancer, and understanding its symptoms and causes can make a real difference. James, let's start with the basics. What exactly is acute eosinophilic leukemia?
Acute eosinophilic leukemia is a rare type of blood cancer where the bone marrow produces too many eosinophils, which are a kind of white blood cell. Normally, eosinophils help fight infections, but in this disease, they grow uncontrollably and can invade tissues and organs, causing damage. Because it progresses quickly, recognizing the signs early is very important.
So, what are the symptoms people should watch for?
There are several. The general symptoms include fatigue and weakness that don't go away, even with rest. Many patients also experience fever and night sweats, or they may lose weight without trying. Those are often the first red flags.
And it doesn't stop there, right? The disease can affect different parts of the body.
Exactly. In the lungs, people may notice a persistent cough or shortness of breath. Some even experience bronchospasms, which feel like asthma attacks. In rare cases, eosinophils can infiltrate the heart, leading to chest pain or discomfort that resembles a heart attack.
That sounds frightening. What about the skin and digestive system?
Skin changes are common. About 60% of patients develop rashes or lesions, ranging from mild redness to itchy or painful patches. Swelling or pain in tissues can also occur when eosinophils build up under the skin. In the digestive system, diarrhea is a frequent symptom, sometimes severe enough to cause bleeding or ulcerations. Abdominal pain can also appear, and some patients report muscle pain or stiffness, which can make daily life difficult.
So the symptoms are wide-ranging, which makes it tricky. Let's talk about causes. What do we know about why this leukemia develops?
There are both genetic and environmental factors. On the genetic side, certain chromosomal abnormalities, like a translocation between chromosomes 10 and 11, are linked to poor outcomes. Mutations in specific genes, such as the FIPL1 PDGFRA fusion gene, can also drive the uncontrolled growth of eosinophils.
And the environment plays a role too, right?
Yes. Exposure to radiation, often from previous cancer treatments, increases risk. Chemicals like benzene, which is found in some industrial settings, are strongly linked as well. Other contributing factors include pre-existing blood disorders, like myelodysplastic syndromes, and even family history of leukemia.
I've also heard of related conditions like hypereosinophilic syndrome. How does that connect?
Hypereosinophilic syndrome, or HES, is when eosinophil levels stay very high for a long time. It can damage organs and, in some cases, progress into acute eosinophilic leukemia. Chronic eosinophilic leukemia is another related condition that can evolve into the acute form if untreated.
Who is most at risk?
Age and gender matter. People over 60 are more likely to develop it, and men are affected more often than women. Lifestyle and environmental exposures also raise risk. Things like working with toxic chemicals, having prior chemotherapy or radiation, or certain viral infections.
Let's move to diagnosis. If someone has these symptoms, what steps do doctors take?
It usually starts with a medical history and physical exam. Doctors look for signs like fatigue, weight loss, or enlarged lymph nodes. Blood tests, especially a complete blood count, can reveal elevated eosinophil levels. A peripheral blood smear helps identify abnormal cells. The definitive test is a bone marrow biopsy, which shows whether immature eosinophils or blast cells are present. Genetic testing is also crucial because identifying mutations or chromosomal changes helps guide treatment.
So early diagnosis really matters.
Absolutely. Because this leukemia progresses so quickly, catching it early can improve treatment outcomes. If someone notices persistent fatigue, fever, weight loss, or unusual rashes, they should see a healthcare provider right away.
James, this has been such an important conversation. Acute eosinophilic leukemia may be rare, but awareness is key. To our listeners, remember, knowledge empowers you to act sooner and seek the right care.
That's right. And while you can't control genetic factors, you can reduce risks by avoiding harmful chemicals, limiting unnecessary radiation exposure, and keeping up with regular health checkups.
Thank you, James. And thank you to everyone listening. This has been the BanishCancer podcast. Remember, awareness of acute eosinophilic leukemia can make a real difference. Knowing the symptoms and causes means you can act sooner, seek care faster, and improve outcomes. Stay informed, stay proactive, and join us next time as we continue bringing clarity to complex cancer topics.